Hello everyone. In this video, we are going to start a new topic, inspection. This is another diagnostic method in our diagnostics. It is one of the most important diagnostic methods in Huangdi Neijing, or traditionally, we describe that if you can diagnose from inspection only, you are the top level of the doctors, or your skills are in the top level. So which means inspection is very important for us. Inspection refers to the practitioner. The doctors use their own eyes to observe clinical phenomena, to inspect the patient's situation, and then they collect the clinical information from the patient. Inspection we actually use every day. Even we are not a doctor, or even they are not a doctor, we are using every day. For instance, because of the COVID-19, because of the lockdown, we have been away from the campus for quite a few months, and that's very possible we're going to continue for a few months. The situation is, imagine that in a few months' time, when we are going back to the campus, when you see your classmates, you will realize some of your classmates has gained like 5 kgs during this lockdown, and the other classmates may be very energetic because they didn't study for the whole lockdown, and then they enjoy the holidays a lot, so they become energetic. You see, these are two examples. And from these examples, when you greet each other, you will have general impressions on your classmates, how they were, how their diet in these few months, how their lifestyle, do they live healthy? So all these information you will generate an impressions in your mind. That is the process of inspection. So as you can see, we use every day. And then from the study of inspection, we're going to tell you that which aspects we are going to focus on and what's the clinical indications for some abnormal situations. So in this chapter, there are 4 aspects we're going to focus on. We're going to have a very short general introduction of inspection. We're going to discuss the inspection of general conditions. We're going to introduce the inspection of local body parts. The last session, we're going to talk about the inspection of excretors. As you can see from the yellow notes there, all images in this document are for the purposes of medical training at UJ. In order to protect the patient's privacy, do not share on social medias. So from the diagnostic, from this study, it is a bridge from the theories to clinics. So in order to help you to get more experience, we will use a lot of clinical cases or images or records, videos to help you to understand some phenomena in the clinic. Please protect the patient's privacy. Do not share on social media. And also, similar to the study we have introduced in previous videos, inquiry. Inquiry, we always discuss with the patient. We questioning the patient with a lot of information. Some information is considered as the private information. So for those information, you need to protect the patient's privacy from the inquiry. Do not discuss, although when we study we have to discuss, but in your daily life, when you discuss with your friends, don't use the patient's cases to discuss, because as a practitioner, the patient give you lots of private information. So be careful of this. The information from the patient, the images that you attempt in your clinics under the consent of the patient. When you use this information, please protect their privacy. So the first introduction, the general introduction. In this session, we're going to use a very short time to talk about this. We're going to tell you why we're going to use or which information we're going to be included in inspection and how to perform inspection. So in this session, the inspection includes general conditions, local conditions, tongue manifestations or tongue diagnostics, excretions, infants index finger venues. The last session is very typical or very special in Chinese medicine. For children under the age of 3, we observe the index finger venues. We're going to show you what's the clinical indication for these different manifestations. And because of the tongue manifestation or tongue diagnostics, there's a lot of information in tongue diagnosis. So we're going to use a separate video to focus on the tongue diagnosis only, which means in this session of inspection, we're going to focus on the general condition, local condition, excretions, and the infants index finger venues. Before we go to the details, we're going to discuss some requirements for inspection. This is very similar to the requirements of inquiry. During the consultation, the patient needs to feel comfortable. Also, they need to feel that their privacy is protected, their privacy is safe with you. So that's a proper setting of your consultation room. The second is the lights of the consultation room. Because of the inspection, we focus on different colors, and the different colors, the light color sometimes will affect your inspection. So preferably the lights will be white natural light or white light. Do not use the light with the colors such as warm white. And sometimes also need to be careful that the color of the wall of your consultation room. Sometimes some practitioners, they consult patient from the room with different colors. Sometimes the color will affect your inspection. So you need to take this into your consideration. Or in the other situation, if you see patients at night with very dark light, sometimes you can't see properly the color of their complexion. So in this situation, you can consult the patient again during the day or in a better light. The second is full exposure of the parts to be examined. This situation, it is important, but also sometimes require more skills. These skills in terms of the communication, the settings. For instance, from a male practitioner, a male doctor, a patient come to you for chest pain, a female patient come to you for chest pain, but you are a male doctor. So sometimes you feel that it's inconvenience for you to examine the patient. So you use all the other methods to check the heart, to check the lungs, without examination, without physical examination, without exposure of certain parts of the body. And after a week, your follow-up consultation, the patient told you that the treatments, they don't see any improvement from the treatments. And then what happens in this situation is, because it did not perform the physical examination, when you ask the patient to expose the chest, and then you see the chest pain is from the skin inflammation. It's not from the heart problem, not from the lungs problem. It's from the skin. You see, this is a very simple situation that you can diagnose from inspection, but this inspection is based on the full exposure of the certain parts of the body. So sometimes if you have to, you need to perform the physical examination professionally, especially in this situation. It is not convenient, and also you need to avoid arguments or avoid disputes. In this situation, you can ask a female assistant to come with you in your examination rooms to observe your inspection, to observe your physical examinations. Then the patient can expose their body parts, even sometimes if it's needed, they have to expose like the breast. So the full exposure is very important, but also it need to be conducted professionally, and also need to avoid the dispute. The third one, suitable room temperature. So this is very important because during the inspection, sometimes we will ask the patient to expose certain parts of their body. So the suitable room temperature is very important. For instance, now you need to turn on your heaters in the room to make the room warm enough, because the cold temperature will affect. The first is the patient don't feel comfortable. The second is, in a cold temperature, in a cold room, the muscle contracts. So you feel even the pulse, they change a little bit, and also the patient become nervous. So all these will affect the inspection. So also will inspect your palpation when we learn in future. So these aspects are very important when setting up the consultation room for inspection. The last aspect is the diagnostic method. We need to combine different diagnostic methods for our diagnostics. For instance, the inquiry we have studied in the previous videos. Now we studied the inspection. The results, the information from the inquiry and the information from inspection, we need to combine them to generate or to conclude to a diagnosis. So we We don't diagnose only from inspection. We don't diagnose only from inquiry. We need to combine different diagnostic methods to conclude into a conclusion for the diagnosis. In this session study for inspection, you will see we provide you a lot of images of about more or less 200 clinical images. The reason is we try to show you what's abnormal. In order to understand what's abnormal, you need to understand what's normal. That's something you study in your physiology. So the second, we're going to talk about the inspection of general conditions. The general conditions includes some or mental activities, and from the next slide, you will see that we actually use the spirit, facial color, posture, and movements. Some or spirits. You see, from the beginning of your study until now, we try to avoid the words of spirit. That's why we use the mind. We use other words instead of using spirit. Spirit, we use a lot in Chinese, but we try to avoid the words, so we use different translation. But now we introduce another word. Sometimes we will introduce some Chinese pronunciations, Chinese words, because these words are commonly known for people in this field globally. So you need to understand when they talk about some, what do they mean about some? So the pronunciation of this is some. Some is also spirit, also the mind. We try to avoid spirit, but now we go back to the spirit because it becomes easier to discuss this session. As you can see from the definition, the spirit here what we refer to in a broad sense. It refers to external manifestations of vital or life activities, include the mind, consciousness, thinking, sight, the vision, facial complexion, expression, body build, and posture or movement. In a narrow sense, spirit means the heart-mind, mental conscious or thinking activities. Conscious activities, as you can see from the definition, that although we use the spirit only refers to these aspects, then they are not spiritual matters. Okay, so from here you need to remember that the concept of spirit in Chinese medicine, what do we mean? That's exactly why in your basic theory, we use the mind, the word of the mind, to replace spirit. Inspection of the spirit involves both of the broad and narrow sense. In our textbook, it gave us 4 aspects how to inspect the spirit. Although we pick up the spirits, the words, this inspection we actually perform every day. In other words, if we don't use spirit, in other words, how we see from our daily life, it's very common that when you see your classmates or your friends, you will say sometimes those guys are energetic. This friends feel fatigue, especially after catching a flu, they feel fatigue. And sometimes they feel tired. They don't want to move. So as you can see, these words are the descriptions we use commonly in our daily life. How do you generate these? How do you generate these conclusions? That's from this we actually call the spirit. The spirit, we're going to focus on the eyes, the mental states and facial expressions, color and lusters, body builds and posture. The first one is the eyes. So in inspection of the eyes, primarily focus on the brightness and movement of the eyeballs. The bright eyes, dull eyes, you're going to see some images in when we discuss the different level of spirit. So the movements, the brightness of the eyes, the first thing you want to see a person is energetic or not. What are you going to see is the eyes. You're going to see their eyes, the movements, the brightness. And the second is the mental states and facial expression. Mental states and can tell the condition of the heart. The heart, mind, action, the chi. This is actually not only the mental states can tell the chi. It's the spirit. What's the fundamental of these activities? That's the actions and chi of Zangfu organs. So from the observation, from all these four aspects, or from the observation, when you say that some people is energetic, what does it mean by energetic? It means that this person got plenty of chi, right? Got enough essence for very healthy condition. That's due to healthy essence and chi. So from the inspection, from these aspects, we're actually going to see the chi and essence in the body. A clear mind with a natural facial expression indicates abundance of essential chi. Wherever an uncleared mind with doubt in expression indicates essential chi failure of the heart. So it's the heart, not only the heart, also the other organs. So the inspection reflects the level of the qi. The level of the qi also reflects the actions. The color and lusters. A moist and lustrous facial skin indicates abundant qi, body, and essential qi of Zangfu organs, wherever dark gray, withered facial skin indicates deficiency or erosion of qi, blood, essential qi. You see essential qi here. What does it mean here? This is because our textbook, the basic theory and the diagnostics, these two textbooks are written by different authors. So sometimes the translation will be different. And also when you use this textbook, you will see some funny translation. A few we have picked up and changed in our notes. So when you see some translation that you are confused with, you can go back to our notes. Because of the translation, some translation is not accurate. So the essence is qi here. It is actually the essence in your basic theory, which means the color and luster can reflect the qi, blood, and essence of harmful organs. The last aspect is body builds and posture. The body builds and posture is the last part of the general impression of the inspection. A patient, a person, not a patient, sorry, a person needs to have a proper body build. Doesn't need to be very muscular, but not too thin, not too fat. And their posture needs to be smooth or flexible in order to have a healthy situation or a healthy condition in our mind. So from inspection, we're going to see from the eyes, from the mental states, how do you see the mental states? From the speech, from discussing, and their mind clear or not. The mental states, the color and luster, the body builds and posture. And until here, sometimes some of you will ask us if they got the color problem, especially in overseas, especially in African countries. We got different races. So we're going to explain in the session of the color discussion. This is very challenging for observation in South America or in other African countries. So the next we're going to discuss the classification of the spirit. The spirit can be classified into 5 patterns: abundance of spirit, lack of spirit, loss of spirit, false spirit, and disordered spirit. You see from your textbook, there are a lot of descriptions on the indications and a lot of information in your textbook. It is very difficult to memorize all of them, but at least you need to remember the titles. For instance, when you inspect a person or inspect patients for the spirits, what aspects you need to focus on? The eyes. You need to focus on the eyes, the mental states, the colors and facial complexions, and also you need to observe their body build or the movements. That's how to, from different aspects, to see the spirit. So the different levels of spirits, these 5 patterns actually indicate different levels of the spirits. In other words, in a very common words, different levels of energy. So sometimes the patient will tell you that they got low energy, they feel weak. That's how we describe in acupuncture theories. So this is very similar, but the abundance of spirit. Clinical manifestation includes bright and active, clear consciousness, natural facial expressions, a moist luster face, a fit body and smooth body movements. Abundant healthy qi indicates that you got abundance of qi and essence. And this is actually in a healthy person or patient with mild medical condition. This situation, we actually think about that the person is energetic. Lack of spirit. The patient will have dull eyes with sluggish eyeballs, clear consciousness, poor spirit, and a lustreless complexion. the patient can be either thin or obese. What does it mean for here is the patient, we actually need to remove the poor spirits here because we're describing lack of spirits. Poor spirits, the term poor spirits doesn't really help you, but from the description you will see the person will have dull eyes, sluggish eyeballs, which means the movements will be slower, not as flexible, not as smooth as the abundance of qi. So in this situation, the person may be in a weak body constitution or with medical conditions. You also can be seen in elders because the elders, they're not that energetic. So in this situation, you can feel that the person still fine, still kind of healthy, but they're not energetic. They look tired. Their movements will be slower, and sometimes they don't want to eat. So sometimes they don't want to speak. They don't want to move. They don't want to speak. And this indicates a lack of spirit. This can be seen in elders or patients with deficiency condition or patient during the remission stage. So they are actually recovering from severe condition. They can be lack of spirit. Loss of spirit. Loss of spirit can occur as a result of deficiency of axons or excess pattern of fetters. What's the difference between the deficiency of essence qi excess patterns, pathogenic fetters? What's the difference between these two terms? For the English translation is actually very obvious because from the translation we give you the terms directly. The loss of spirit as a result of deficiency essence, deficiency essential qi. It actually indicates that this pattern is deficiency patterns. As a result of excessive pathogenic fetters, this is the excessive pattern. So these two, from here you need to think about in the basic theories, because we introduced the deficiency pattern, we have also introduced the excessive pattern. Do you still remember what's the deficiency pattern? What's the excess pattern? Or what's the root cause? What's the most important aspect? The deficiency refers to the deficiency of antipathogenic qi. The excess refers to the excess of pathogenic qi, the pathogenic factors. So these are the difference between deficiency and excess. The loss of spirit due to deficiency includes the dull eyes with sluggish eyeballs and listlessness or unconsciousness, empathetic impression, lustreless compression, a low, faint voice, weak breathing, emaciation, and difficult body movements. This stage, as you can see from the picture, this is actually a very severe condition. This picture indicates the loss of spirit, but doesn't have to be the deficiency, it also can be accessed. So from the expression, we won't be able to see it from the excess or deficiency. But for how we're going to see the eyeballs, as you can see the eyeballs, the eyelids, the patient could not open the eyes, the breathing, also the movements. So that's the severe damage to the healthy qi and essential qi. It often seen in patients with chronic critical condition and may indicate unfavorable prognosis. The loss of spirit due to excessive pathogenic factors. The patient can present as unconsciousness, delirium, they speak funny stuff, they don't even know what they are speaking, restlessness, picking up at bad clothes, and picking off flocks of wolves. This translation is quite funny actually, so it might not easy for you to understand. So you can go to your notes, page 52 or 33. You can see a small boy was picking up something in the air, or that's the description of lots of spirits. So you can see the notes on page 52 or 53. Patient can be unconsciousness, stupor, rapid breathing, flat sounds in the throat, and sudden faint with closed hands and locked jaw. So in this situation, the reason of this situation is the excessive pathogenic qi affect the heart mind, or the phlegm due to the liver can block the meridian. And this happens in excess pathogenic factors or liver wind that carry the phlegm, disturbing the heart mind. So from the diagnostic study, we need to connect the theories and the clinical phenomena. That's why we need to use the basic theories to explain these phenomena: unconsciousness, delirium, restlessness. Why the patient will have these different symptoms, different signs? That's because of the heart and mind. You need to think about what elements in charge of these signs or the symptoms, what elements in charge of the consciousness. That's the mind. The mind is the heart. So something affects the heart. What can affect the heart? It can be the pathogens. It can be the phlegm due to the liver wind. How do you see the liver wind? How do you know the liver wind? We're also going to explain again in future, but now we're going to explain it once. At the first time, then it will be easier for you to understand these symptoms. The wind. First, the heart mind we have explained as the heart. Houses the mind. The second is the liver wind. Because the picking up and picking off is a kind of movement. In the pathogens, which pathogen can move? Which pathogen can move? That's the wind. Okay, so that's the wind. And then you go to the internal 5 evils. Which wind can cause the funny movements or involuntary movements? That's the liver wind. From the liver wind, you also can see from other symptoms, such as from the tongue. When we study the tongue diagnosis, you will see from when the tongue was affected by the liver, by the wind, you will see different symptoms. So that's how to explain these symptoms from the theories. As you can see from the textbook, you got your textbook, you got a lot of clinical manifestation. The clinical manifestation, all these, sometimes it's very difficult to remember. What's important is you need to use the theories to explain, such as here, consciousness. How do we understand the unconsciousness? Why the patient will be unconsciousness? You need to use the theories. That's the heart. Something affects the heart that can result in unconsciousness. Delirium, they speak funny. You don't know what they are speaking. These are also the mind. It's also the heart. Okay? The flame. What's the flame? Where the flame come from? It can affect from the spleen. So that's how to use the theories to explain the clinical symptoms. False spirits. The false spirit, if you see the face color is dull, but you can see the red color here or pink color on the cheek. This situation, the patient most of the time the patient is in a severe condition, and then all of a sudden the patient recovers. The patient feel better, the compression looks better. It's actually the collapse of healthy qi and drain essential qi, failure of zangfu organs. From this false spirit, sometimes you will ask, the patient looks fine compared with the abundance of spirits. They also appear similar. They got the red color here. They looks fine. But why this patient is a false spirit? This is because the situation, a sudden change from mental unconsciousness. So this patient has a long-term severe disease and very bad condition, and all of a sudden, this, all the situation, all the conditions improve. So in this situation, you need to be careful. That's not recovering. It's actually the false spirit. The false spirit. Sometimes we can see in daily life that the patient before they pass away, they be in a very sick condition, and all of a sudden they recover. They want to eat. Their appetite recovers. They want to meet their families. In this situation, sometimes especially after long-term diseases, you need to be careful that this might be a false spirit. Why the patient don't have appetite for quite a long time, and all of a sudden the appetite improves. The patient feel fatigue for all the time. All of a sudden, the patient feel energetic, and they want to see their families. This is actually sometimes most of the conditions the final stage of their life. So the patient may pass away very soon. So the false spirit is a severe situation. So when you see a patient in this situation, you don't think that the face complexion, the face color, the red color is the preferable color. The patient is recovering. That's the false spirit. So you need to keep in mind. There is a last session of the spirit inspection, the disorder of spirits. We are going to discuss in the next video. Thank you, everyone.